Hi everybody and welcome to day one of our back pain challenge. So today we are going to discuss breathing, why the way we breathe is so important and how it can play a very vital role in contributing to the pain we may be experiencing. So if we think about breathing and we think about when we're in pain, how we might breathe. So generally what you might find is that when you breathe in, it's a very small, shallow breath. Short, sharp breaths taken in high, not getting that expansion, breathing in as we go through the nose. As we breathe out, you may well find that you're not fully exhaling, so you're not fully letting that air expel from the lungs, you're keeping in this very narrow. So we're in this braced position with that little bit fixed, a little bit elevated, we're not getting that much air in or out. So when we move and when we try and bend forward, say to try and put our shoes and socks on, it's going to feel very difficult, it's going to feel very uncomfortable. So what we want to try and encourage is some normal full inhalation and full exhalation. So we'll talk through why it's so important in relation to your core muscles and how they all link in together. So as we take a breath in normally, what will happen is our air will get right down to the base of our lungs and our rib cage will expand out and forwards, and our diaphragm muscle will push down. So our breathing muscle will push down. Our pelvic floor will push down also, and everything drops. As we breathe out, everything goes the other way. So our diaphragm lifts, our air comes up and out, so our diaphragm lifts, our pelvic floor lifts, and our rib cage drops down. So our rib cage draws down towards our kind of hip bones, which causes that tummy muscle at the front, so our abdominal muscles, to shorten in size. So they shorten, they become more stable in that position that they're in. Now, if we think about our core, which everyone's heard of, it's a very fashionable word, but not many people truly understand what our core is. It's actually made up of all elements, so it's a cylinder. So it's that breathing muscle on top, our pelvic floor underneath, our deepest layer of tummy muscle, our transverse abdominis at the front, wrapping round as a corset, and then our small spinal muscles at the back. And when all those four elements work in sync together, that gives us a really stable platform to move functionally from. So what we're going to try and practice is a little bit of a breathing drill to incorporate all those things that we've just talked about. So I want you to gently place your hands onto your rib cage, and we're going to try a breath in for 4 and a breath out for 4, but we're going to try it through the nose both ways. And this is to encourage you to keep it slow and to really get all the air in and all the air out. If you're used to mouth breathing, it's probably going to be very fast, very quick. So this is a slower way to take it. So let's start by breathing in. And then breathing out through the nose again. So we're going to try that 2 more times. So as we breathe in through the nose, I want you to feel those ribs start to lift, those fingers, those hands draw out. And then as we breathe out through the nose, I want you to feel those ribs gently drop and rib cage draw down, that tummy position between belly button and rib cage getting smaller. And let's try one more. Breathing in. Nice and deep for 4 and hold. And can we breathe out through the nose all the way to 4? Can we feel those ribs glide down? And then just take your breathing back to normal. Now that can be quite a challenge, especially if you've been very used to breathing higher up and you've not got, even if you think your breathing is generally quite good, have a practice, because you'll probably be quite shocked to see how actually you're not fully breathing out, you're not fully exhaling to the extent that you should and that you can. So have a practice. This is going to help kind of set the precedent for the next few days, because breath we're going to be using a lot when we go through all of the other movements. And give it a go. Any questions, give us a shout.